All right. Hi, everyone, and welcome to today's presentation. Thank you, Rachel, for the introduction. As you mentioned, my name is Andrea Russell, and I primarily work out of the Tyrone office. So today I'm going to be talking about a subject that probably most of you have heard of, and that's cataracts. But I'm going to give you hopefully a little bit more information and also tell you a little bit about some of the treatment options that we have for them. All right, so what is a cataract? So a cataract is basically just a clouding of the natural lens inside your eye. And just like a camera lens, if this lens becomes cloudy, things will start to appear blurry. Most cataracts develop very slowly, so they usually don't affect your vision early on. However, as they start to advance, they can make it difficult to read, drive, especially at night. So here's a little diagram over here. This is a clear lens. This is what it should ideally look like. And then as a cataract develops, it starts to take on a yellow color and become a little bit cloudy. So I'm just going to show you a little bit of eye anatomy. So this is basically a cross-section of your eye. The part that we're talking about when we're talking about cataracts is this part right here, and this is your intraocular lens, okay? And as you can see in this diagram, it's nice and clear. This is what it would look like in a young, healthy individual. And basically what happens is the light enters in through this black part or the pupil in your eye. The lens can change shape and help to refract the light and focus it on the back of your eye, your retina. Again, if we're going to use a camera analogy, the retina is basically a thin piece of tissue that's almost like the film in a camera. So the lens kind of helps shape the light, and then an image is formed on your retina. So here's another diagram. You can see the kind of lights coming in, and then a clear image is hopefully forming on the back. As I said, this lens can kind of bend and change shape, and it, along with the cornea, this front surface of your eye, really helps focus the light on the back. So when cataracts develop, this light, they both block and scatter the light so that an image is no longer clear. It starts to become distorted, and that's why your vision gets blurry. So here's just a little diagram showing what someone with cataracts, how they view the world. So this one over here to the left is nice clear vision. And this is kind of an early, I really consider it more a moderate cataract. You can see things start to get pretty blurry. Definitely the colors are starting to dim out. And then over here, of course, is a very advanced cataract. This is definitely one that would need treated, pretty urgently. As you can see, this person, really has virtually no vision. So these are three of the types of cataracts that I see on a daily basis. These are by far the three most common. Most of them are primarily related to age, but sometimes other conditions can cause them as well. So the first one is a nuclear cataract. This is probably the one we see the most common. And basically what happens is you start getting a yellow or clouding in the center of the lens, the nucleus, and then the clouding virtually kind of goes out towards the edges of the lenses, as the cataract develops. This cataract typically forms really slow. A lot of times I can see this, and it can be up to 10 years to patient really becomes symptomatic from it. If you go over here, the next type is the cortical. And this is basically where the cataract starts forming on the edge of the lens. You actually get these little spoke-like opacities. As you can imagine, this can really scatter the light. These people get a lot of light sensitivity, a lot of nighttime glare and haloing. And this one's also believed to be caused, sometimes from UV exposure. So this is where wearing sunglasses could be beneficial. This last one over here is a posterior subcapsular cataract. This is definitely the one that interferes with the vision the most. It actually forms on the back part of the lens, and it's usually right in the line of the visual axis. So people get really blurry when they get this type of cataract. A lot of people have a lot of trouble reading, a lot of trouble driving. This type does tend to progress a lot quicker than the other two types. Sometimes people can get this cataract and even in a couple months they need it taken out. So here are just some different types. We already kind of talked about the top three, but I did want to mention one other one, and that is congenital cataracts. This is the type of cataract that you're born with. These are kind of interesting. They can take on a lot of different shapes and colors. Some can be sparkly, some can have multiple colors, some can even look like a Christmas tree. Luckily, most of the time, these are small and asymptomatic. In fact, most of our patients don't even realize that they have them until they come in for a dilated eye exam, and then we kind of see them, during their exam. However, sometimes they can be large and problematic. If a baby is born with a significant cataract, it often will be removed early in life so that they can develop good vision. So just some symptoms. The biggest symptom, of course, is just blurry or dim vision. Sensitivity to light, that's another big one, especially with some of the posterior subcapsular cataracts and some of the cortical cataracts. Nighttime glare or haloing, trouble driving at night, trouble reading. And you can also get sometimes some fading of colors or some double vision in one eye. Fading of color is something that's kind of interesting. Hardly any of my patients ever complain about it when they have the cataracts, but almost everybody notices how bright and vibrant the colors are after their surgery. So as I said, the number one cause of most cataracts is age. Cataracts do develop as part of the normal aging process. The proteins in your lens actually begin to break down, and they cause small opacities or clouding of the lens. This process actually starts usually in your 40s, but it's not usually till about the 60s that we can actually start seeing it or noticing it. And in fact, many patients don't actually have trouble with cataracts till much later into their 70s or their 80s. An eye injury or surgery is another major cause we see. Any significant injury to the eye or the head can cause a cataract, as can certain types of eye surgeries, specifically retina surgeries. If you've ever had a retinal tear or a retinal detachment, you're likely going to develop a cataract a little bit sooner. Genetic disorders can cause cataracts, birth trauma, or any sort of infection during your pregnancy. And also some medical conditions or drug use can cause cataracts. The two biggest that we see, honestly, on like a daily basis are diabetics. They tend to get cataracts much younger and also much more severe. And prolonged steroid use. If someone has Crohn's disease or uncontrolled asthma, sometimes you can get these cataracts. Usually with these conditions, you get the posterior subcapsular cataract. So as I said, this is the cataract that tends to progress a lot quicker and tends to really interfere with your vision. So a lot of times these cataracts do need to be removed. So unfortunately, there's really no way to prevent cataracts. They are part of the normal aging process. We tell people if you live long enough, you will eventually develop a cataract. However, certain lifestyle changes can slow the progression. Just like everything else, eating a healthy diet high in fruits and vegetables is really important. The antioxidants can really help slow down this aging process. Wearing sunglasses, again, that can really help decrease your risk of getting those cortical cataracts. Quit smoking can just kind of slow that aging process. And just managing your systemic health, especially if you're diabetic, keeping that control can really help you prevent getting cataracts early. So there are some treatments. Early on, simple things such as increasing the light can make a big difference. When you have a cataract, you need more light to get a clear image. So I tell patients, if you get like a light that can kind of bend down and has an arm, you can put right on what you're reading. That can really help. Sunlight's great. If you have a big window you can sit beside, that really works well. Talking to your doctor about getting an anti-reflective coating on your glasses can really be beneficial. I recommend this for anyone with early cataracts. It really just helps with night driving, decreases the glare, decreases the haloing. Getting a good pair of sunglasses, not only does that protect your eyes, but if you're becoming very light sensitive due to your cataracts, this can also help. And early on, we will sometimes update glasses. This is something that I do tell people, if for some reason you don't want to have the surgery quite yet, or you have medical conditions, you want to delay it, updating glasses can definitely really improve your vision. But I tell all my patients, this is usually temporary. Once the cataracts start growing to the degree that they're changing your prescription, it usually is a sign that they're almost ready to be taken out. A lot of times if we update your glasses, they may only work for 6 months, maybe a year, until the cataracts continue to change your prescription. So again, it's an option, but it's definitely something that's temporary. So then the last thing is, of course, cataract surgery. I know this sounds pretty scary, but in most cases, cataract surgery is a safe and effective way to eliminate the visual problems caused by cataracts. It's one of the most common surgeries and most successful surgeries being performed worldwide. And nowadays, people are choosing to have their cataracts taken out at a much younger age so that they can maintain their active lifestyle. In the past, we kind of said you had to kind of wait till they were ripe. That's not really the case anymore. In fact, a lot of surgeons actually prefer to take the cataracts out a little earlier when the patients are younger, when they recover quicker, and the cataracts are softer. So the big question is, when do you need cataract surgery? Most people will have significant cataracts that would be beneficial for surgery by the age of 80. However, most people will choose to have them out a lot sooner. I would say the average age that I see is sometime during the 70s. If your cataracts are starting to blur your vision and they're interfering with your lifestyle, you should talk to your doctor about having them removed. The good news is there's really no rush. Cataracts, as I said, usually grow very slow. They typically don't hurt your eye unless they're extremely advanced. So there's really no big rush to get them taken out. However, there's really no benefit in waiting, especially if you're symptomatic. As I said, sometimes taking the cataracts out a little earlier makes the surgery a little bit easier, and allows you to recover a little faster if you're younger and healthier. So I'm going to talk a little bit about a history of the cataract surgery. So cataract surgery is one of the oldest surgeries being performed. Actually, the earliest form of this surgery was known as couching, which is basically where they would take a sharp needle, they would poke it in your eye, and they would actually poke this cataract out of the visual axis. The cataract was not removed from the eye. In fact, it was just kind of pushed off to the side or even poked into the back of the eye. Surprisingly, this actually did lead to temporary improvement in the vision. However, as you can imagine, a lot of these patients developed infection and inflammation, and a lot of them eventually went blind. It actually wasn't until the 1970s most cataract surgeries were performed using an intracapsular cataract extraction method. With this method, they actually went in and the surgeon removed the entire intraocular lens. This required an extremely large incision in the cornea, and so that the cataracts actually had to be a certain amount of hardness, or they had to be like ripe, as you used to hear. Although this was successful, this method was extremely risky, and it often caused retinal problems, infection, and it also required a very long and difficult recovery process. I actually have a lot of patients that remember their parents or their grandparents having this surgery done. A lot of them are really scared to get the cataract surgery, performed, because they remember this and they're concerned because their parents had to lay for days, extremely still. Sometimes they use sandbags to kind of help people not move, because you had this large incision, and you also didn't have anything really holding that lens in place early on, so you had to be very still. Fortunately, today's modern advances have made cataract surgery completely different than in the past. It's much, much safer and more effective. Cataracts are now removed using a process called phacoemulsification. This is basically where we use sound waves to break up the cataract, and then we suck it out of your eye. Since the cataract is no longer removed whole, a much smaller incision can be made in your cornea, and the cataracts can be removed at a much earlier stage. As I said, now it's actually easier to remove an earlier cataract because it's softer, it's easier to break up, easier to suck out of the eye. The nice thing with the modern procedure is it is now an outpatient procedure for most patients. It might still be done in a hospital, but you go home at night. You don't have to spend the night in the hospital. You'll usually be given drops, to kind of numb your eye. And then you are given a medication through an IV that makes you sleepy. But most patients will still actually be awake during the procedure. This is really important because it makes it so much safer, especially for patients with heart issues, you're not completely put under. And it's also nice too, because if this surgeon needs you to look a certain direction or move around, most people are able to follow his instructions. However, most people still remember very little about the procedure. You usually have very little, if any, pain during the procedure. A small incision is made into your cornea, so the front part, and then an ultrasonic device is put in that breaks up the cataract, and then the cataract is vacuumed out of your eye. After that's done, the surgeon will put an artificial lens in your eye, and that actually will help focus the light on your retina, just like your natural lens did. What's neat nowadays is that a lot of times this lens can help correct your vision. You may not need glasses after the surgery, or at least not as often as you used to. Most people require no sutures. The incisions are so small that the eye usually helps seal itself and heal off. So there's no long waiting period. You don't have to hold still or do anything like that. So here's a little diagram kind of showing what we're talking about. This is an intraocular lens that the surgeon will put in your eye. It's basically a piece of plastic or silicone, and it has these like little arms called haptics that kind of help hold it in place. So this lens is put in the same spot as I showed you the intraocular lens was before. And what's nice with the surgery nowadays is they don't completely remove this lens. In fact, they actually leave the back surface, which is like a little bag that helps hold this intraocular lens in place. So when they put the artificial one in, it kind of just sits right in the bag, and these little arms kind of lock it in place. This makes it really sturdy. A lot of patients are worried that this lens could pop out or move. And that's actually highly unlikely, especially after the first 2 weeks when it kind of scars down. It is pretty stable in your eye. So the recovery is usually relatively painless and fast. Most people see well by 1 week after the surgery. Most people will need glasses for reading after the surgery, but many can see well at distance without the need for correction. And nowadays too, there are different lenses that the surgeon can put in. You know, sometimes you can choose to see well far away. You can choose to see well up close. There are even bifocal lenses that are available that can sometimes help people not need glasses at all after the surgery. So that's definitely something that if you're interested in that, you know, you do want to talk to your doctor about some of your options. Most surgeons do require you to be on drops for about 1 month. They also require some other minor restrictions. The big things I like to tell people is you do want to try to avoid heavy bending and lifting for about the first 2 weeks. We usually say no more than about 10 pounds. You also want to try to avoid getting water in your eye. You know, if you shower, you want to kind of lean back. You don't want to be running a lot of that dirty water in your eye. Definitely no swimming for 2 weeks. You know, try to avoid eye makeup for about 2 weeks. We usually will give you a little shield to wear at night for like 5 to 7 days just to protect your eyes while you sleep. We also give you a pair of really fashionable sunglasses that we have you wear when you're outside. And this just kind of helps prevent dirt or dust from getting into your eyes and risking an infection. You also should be prepared. You will have to see your eye doctor several times during the first month. And this is just to make sure that your eye is healing as expected. So even though this surgery is very safe, you know, it's definitely not something to take lightly. You know, there are still some risks and complications. And as I said, it's not, you know, this is an actual surgery. You know, they do have to go into your eye. You know, so there is a risk of infection. And that's the biggest thing that we worry about. You know, we will put you on drops afterwards, antibiotic drops to prevent this. A lot of times a surgeon sometimes will even release an antibiotic in your eye during the surgery to help prevent this as well. But it is still a big risk. You know, eye infections after cataract surgery can be serious. You know, so that's why we need you to use your drops and make sure you come to your follow-up so we can check you. Retinal detachment is also a risk. Again, it's not real common, you know, but especially if you have a complicated surgery or if there is something that goes wrong during the surgery, sometimes your retina is at risk. So that's another reason why we like to check you afterwards. We dilate you to make sure that if we see this, you know, hopefully we can get it fixed pretty early. Inflammation is something that's really common. This happens even during smooth surgeries. Again, it's usually treated pretty easily, but it is something we have to watch for. Bleeding is not something we see a lot because a lot of these tissues don't have a lot of blood supply, but sometimes, especially if you have a combined surgery or a more complicated surgery, sometimes we will do like combined cataract and glaucoma surgeries. You know, sometimes we do see some of this bleeding. Swelling is another one we do see pretty commonly. Again, especially in diabetics, you're a little bit more prone to get some swelling afterwards. And again, we will put you on drops to kind of help prevent this. Most of these complications are temporary and can be treated. However, I do tell patients there is a small risk that you could have permanent vision loss or blindness. So again, you do just want to make sure you follow the protocols, you know, and you're not having this done, you know, unless you do actually need it and would benefit from it. So in summary, cataracts are extremely common. You know, if you live long enough, you're likely to develop them at some point. Although they cause a multitude of visual problems, the surgery is a safe and effective way to treat them for most people. And I do tell patients cataract surgery not only improves your vision, but it also can increase your quality of life. Especially in older patients, it can decrease the risk of car crashes, falls, and social anxiety that happens with poor vision. All right, so I do have some references if anyone wants to read a little bit more about this or check something out. And now it's just time for questions if anyone has some.
Thank you, Dr. Russell. We do have a few questions here, so we'll jump right in. If any of you guys have questions, go ahead and click the Q&A button along the bottom of your screen, or you can also type them in the chat box and we will get those answered for you. So we'll start here. Dr. Russell, the first one is, I have read cataracts can also be caused by excessive deposition of calcium. Is that true?
I mean, there are different things that can cause that. Again, you know, sometimes with different systemic diseases and metabolic diseases, you can get different buildups that can cause them, but it's not one of probably the main cause.
All right, thank you. Next one here, I have dry eyes. Am I suitable for cataract surgery? I'm worried it would exacerbate my underlying inflammation.
Yep, so that's actually a great question. Most of our patients that have cataract surgery are older, and a lot of them do have dry eyes too, but that is definitely something that we want to treat prior to the cataract surgery. So a lot of our patients, if they're not on a dry eye treatment, we will kind of start them on that before we send them out for cataract surgery. So I would say if you have dry eyes and it's being treated and you're pretty well controlled, there's definitely, it's safe to have the cataract surgery. But if you're not doing anything like using drops or doing warm compresses or cleaning your eyelids, that's something you definitely want to start before you do this cataract surgery. Sometimes we will delay the surgery a couple months until we get the dry eye under control.
And this kind of connects with that. Is there any technology to remove cataracts with a laser without making a cut, kind of reduce the inflammation that comes with that?
Yeah, so another great question. At this point, there's no surgery that's completely laser, so it is still an invasive surgery, but there are different surgeons that can use a laser for a lot of parts of the surgery now. So they actually can use a laser to make the incision, which is nice, because sometimes it is more precise. They can actually use the laser now to help kind of break up the cataract. Sometimes they'll break it up with a laser first. This is really helpful too. Sometimes it requires less of that ultrasonic heat in your eye, and sometimes that can be beneficial to decrease inflammation as well. But ultimately, it's not completely done by a laser. The surgeon does still have to come in, and kind of remove the cataract and put the artificial lens in. But if you're interested in that, a lot of the surgeons in the area are starting to do some of the parts with a laser, which can decrease your inflammation. Yep.
All right. And will making an incision on a cataract deteriorate the corneal nerve density?
There is to some degree. It is true. When you make a corneal incision, it can cut some of those corneal nerves. And that's why a big side effect after surgery is some patients can have an increase in dryness, because some of those corneal nerves can be damaged. But again, nowadays, this incision that people are making are super, super small. So that's usually not something that we get too concerned with. In the past, when they had to make those large incisions, yes, that definitely damaged a lot of the nerves. But nowadays, the incisions are super small. Most people don't even require a suture afterwards or a stitch. So some of the corneal nerves are damaged temporarily. Again, usually by 6 months, though, a lot of those have kind of recovered, and a lot of the dry eye symptoms have decreased.
Wonderful. And now someone that has had cataract surgery, they are having problems with haziness. They did have scraping, but it didn't really help. Can anything else be done to help with this haziness? And are they worried about losing their vision at some point?
That's definitely, sometimes people can have some problems afterwards. I would say the best advice is to go, if you haven't seen your doctor recently, I would go back in and make another appointment, make sure you share some of your concerns with them. The biggest thing is, which it sounds like this patient already had done, is sometimes you can get a little bit of scar tissue on that kind of bag that they left in the eye from the previous, from your normal lens. So sometimes after the surgery, you will have to go back in and get a laser procedure to clean that off. That is really common. If you already had that done, then that might not be your problem. Sometimes after cataract surgery, people can get some swelling in the cornea as well, especially if your cornea wasn't in great shape prior to the surgery. So sometimes there are different drops we can do to kind of get rid of some of the corneal swelling if that's causing your hazing. There is also a chance too that you could have a little bit of swelling in the back of your eye on your retina. And again, sometimes there are drops we can give you to kind of help with that. So I'd say the best thing to do is just kind of to go in, get a dilated exam, and see if the doctor notices anything else that's causing your problems.
All right. And one last question here. It says, I have a mild astigmatism. Am I suitable for surgery?
Yep, another good question. Mild astigmatisms, a lot of times they don't have to do anything special for your surgery. If it's really mild, a lot of times they're just put in a normal lens. The only downside with astigmatism is that it may make that you might have to wear glasses a little bit more after the surgery. If you have a large amount of astigmatism, the lens that they put in may not correct that. And all that means is you could still see great after the surgery, but you may have to wear glasses, both for distance and for up close. However, the great option now is that we can actually put an astigmatism lens in your eye. So if you have a small amount, I usually don't recommend that. But if you have a large amount of astigmatism, paying a little bit extra to have a specialty lens put in your eye can really make your vision fantastic after the surgery. They're relatively easy now for the surgeon to put in, but they usually are additional cost. You do have to usually pay a little bit out of pocket to have that specialty lens, but it does really improve your vision. But even if you don't want to pay for that, the regular cataract surgery, still works. It doesn't really matter if you have astigmatism. It just might mean that you're more dependent on glasses afterwards.
Thank you, Dr. Russell. And I did have one more pop in. I think it's kind of a more detailed question,
Mhm.
but I will kind of just send that over to you. What different type of cataract lenses can be put in the eye? I know you
Yeah.
kind of touched on that, but.
Yeah, so another great question. Some of it depends on your surgeon. They don't all work with the same lenses, but there's a lot of options. So I'll just kind of go over some of the big ones. So most people do choose to just put in a lens that corrects your distance vision. So this is just kind of your standard lens. Most of this is covered by your medical insurance. And a lot of these patients, it's not a guarantee, but a lot will see really good for distance without glasses. Some patients will also choose to do the opposite, where they're still get a standard lens put in, but they're actually have the surgeon make it so that they see well up close so that they can read and everything without glasses. And then they're put on glasses to drive. There's also, some different options that we can do. As we said, the astigmatism lens is really, really popular. And this is if you have a high amount of astigmatism, they can actually put in a lens that can correct that. Again, this is mostly geared for distance. So we kind of put that in. Most people can see well at distance, but they will still usually need glasses for up close. There's also now what we call multifocal or bifocal lenses. So the surgeon actually can put in a lens that can allow you to see both far away and up close without glasses. These are becoming more popular. They're definitely a little harder for the surgeon to put in. And of course, there is a fairly large out-of-pocket expense for these. But they are great, especially if you're younger and you're still really active. Sometimes you can use this lens and not really need your glasses much at all. We do tell people these lenses aren't a guarantee. There are sometimes, some increasing glare and things with some of the specialty lenses, but they're still, a great option.
Thank you so much, Dr. Russell. I believe that wraps it up. So if any of you have any additional questions, please feel free to reach out to your doctor. You can reach out to us as well. But thank you all for the great questions and sharing with us today. And Dr. Russell, thank you for the presentation.
Yep, thank you, Rachel. Bye.